Dr. E with immunotherapist.com. Today I wanted to address why I should use neurodynamic sliders over tensioners to start. Well, one, often with tensioners, or say for median nerve, if you abduct the shoulder, externally rotate, extend the elbow, fully supinate and extend the wrist. Right now I'm getting a comfortable paresthesia. Research by Shacklock showed that when he did ultrasound at the wrist with side bending toward, there was increased median nerve excursion. So if you think about it, from taking up the slack of a rope, and you slack the rope at one end, of course you're going to be able to pull the rope a little bit more at another end. So we know from modern pain science that we shouldn't actually cause pain. So you don't want to treat pain with pain. You don't treat fire with more fire, right? So to start, if someone already has active symptomatology, whether it's paresthesia or pain radiating down their arm or leg, I usually start with a slider because it enables increased range of motion throughout the range. It's much more comfortable. And I know as clinicians we want to stretch and stretch and stretch, but getting to end range and going through a full range of motion versus tugging the string and playing tug of war on both ends, and this is kind of uncomfortable, and no one really likes lightning shock of pain. If you increase the threat, the stretch tolerance is not going to increase. If you decrease the threat and make the movement novel and comfortable, you're going to be able to reach end range, and we all know from MDT that end range is where the magic happens, and that's where the CNS gets bombarded with healthy, proprioceptive, and novel information, non-threatening information. So it's more likely to make a difference. There's a whole lot of other things you can do if they can't even tolerate a slider. You can do ISTM along the neural pattern. You can compressive wrap with something like an edge band or TheraBand, because compression also makes the area feel stable. Compression is comfortable, and it's also something else that could increase wrist motion at the end of a range. So you can try ISTM, you can try compression, or simply just slack the proximal end. If you do, so for example, head side bend and rotate toward for any of the upper limb tests, and for something like a slump test, instead of flexing the trunk and flexing the head, you can extend the trunk and extend the head when you flex the hip, extend the knee, and dorsiflex the ankle. So start with sliders and then progress to tensioners. Part of next week will be what to do when someone is actually responding to tensioners, and a further progression after that.